Thanks very much for joining us again today. I'll start as usual with today's COVID statistics. The total number of positive cases reported yesterday was 1,196. That is 16.9% of people newly tested, and the total number of cases now stands at 45,232. 416 of the cases were in Greater Glasgow and Clyde, 309 in Lanarkshire, 161 in Lothian and 104 in Ayrshire and Arran. The remaining cases were spread across 9 other health board areas. Only Shetland today has no reported cases. I can also confirm that 629 people are currently in hospital. That's an increase of 27 since yesterday, and 58 people are in intensive care. That is 6 more than yesterday. I'm also very sad to report that in the past 24 hours, 9 additional deaths were registered of patients who had first tested positive over the previous 28-day period. That means the total number of deaths under the daily measurement is now 2,594. And again, I want to send my deepest condolences to all those who have lost a loved one to this virus at any point during the pandemic, but obviously, of course, in particular, to those who have more recently been bereaved. There are a few items I want to briefly cover today before handing over, before the Chief Medical Officer and I take questions from the media. As I often do on a Friday, I'll shortly give an update on the quarantine requirements for international travel. I'll then say a word about the opening of 2 new walk-through testing sites. And finally, I want to say something about this weekend. Before that, though, let me just start with a special word about schools. Obviously, many schools will soon be returning from the October break, while others are just now preparing to start the half-term. But I wanted to take this opportunity today to say a very big and a very heartfelt thank you to teachers, to other school staff, to pupils and to parents across the country. I know that you have faced many challenges over the past few months. I also know that because of the restrictions, the October break will not be all that you might have hoped it would be. But we mustn't lose sight of what you have achieved during this first half term. It is down to your efforts and your ability to adapt in extremely difficult circumstances that schools have been able to return. As a result, the vast majority of pupils are now able to have the classroom and the wider school experience that was lost back in the spring. And I don't think we should underestimate that. It is a real achievement that young people have been able to have that normal schooling experience for the last number of weeks that they lost out on for much of this year. So that, I think, is something important and something positive in this difficult period for all of us to mark and reflect on. Now, I know there will be further challenges ahead. I think that is almost inevitable. And I don't want to stand here today and give any sense that I am underestimating how difficult it will have been so far, not least for teachers. But I just wanted to put on record my thanks to all of you for the really important work that you've done, and so that you know that in spite of all of the difficulties, it is hugely appreciated, and it is very important for not just the well-being of our children and young people now, but I think for their future prospects as well. So thank you to everybody for that. Let me now turn to my first update of today. That concerns a list of countries that are subject to quarantine requirements. We announced last night that Italy, San Marino and the Vatican City State will now be added to the list of countries with quarantine requirements. That means from 4 a.m. on Sunday, people travelling to Scotland from these places must self-isolate for 14 days on their arrival or return here. We've also announced that Greece and all of the Greek islands, apart from Mykonos, will now be removed from the list. So from Sunday, people arriving from Greece or any Greek island other than Mykonos will no longer be required to self-isolate. However, if you have arrived from these places in the past 2 weeks, or if you arrive later today or tomorrow, you will still be required to self-isolate for 14 days. These changes are just an example of how quickly levels of the virus in any country or area here at home and of course overseas can change, and that is the nature of an accelerating global pandemic. And that, of course, underlines why we are continuing to advise all of you against any non-essential travel overseas right now. That's not an easy or a welcome thing to be doing, I know, but it is a reflection of the uncertainty and volatility that all of us continue to live through. My second update today is about the opening of 2 additional walk-through testing centres. One of those sites opened in Dundee city centre today, another will open in Sighthill in Edinburgh tomorrow. These add to the 7 walk-through centres already open, 2 in Glasgow, 1 already in Edinburgh and 1 each in Aberdeen, St Andrews, Western Bartonshire and Stirling. A number of others are due to open in the coming weeks. Many of these centres are within walking distance of student campuses, deliberately so, and so are particularly useful for our student populations. But it is important to note that they are open to all members of the public, and you can book a test by going onto the NHS Inform website should you experience any of the COVID symptoms. There are, of course, a few points that I would ask everybody to remember if you experience symptoms and book a test. Firstly, please don't use public transport to travel to any testing centre. If you don't have a car and if you're not able to walk or perhaps cycle to a testing centre, please book a home testing kit through NHS Inform. And in addition, you should start to self-isolate from the moment you start feeling the symptoms of COVID. You shouldn't wait to get a test or to get your test result back before you start self-isolating. So that means staying at home with the sole exception of if you need to go into a testing centre for your test. Finally, today, I want to say just a word or two about this weekend. I appreciate, I think probably we all feel this, that it's at the weekend when the temptation to bend the rules a bit will be at its strongest, whether that is about meeting up with others or going round to somebody else's house, a member of your family or a friend. I also know that for football fans, and this weekend in particular, perhaps for Celtic and Rangers fans, that temptation might be even greater. Tomorrow, of course, sees the first of these Glasgow derbies to be played without fans in the stadium. Of course, it's also taking place at a time when we have additional restrictions on household visits and hospitality. So with that in mind, I want to underline a few key points ahead of the match, and I should say that both clubs and the SPFL are also emphasising these points to supporters, and I'm very grateful to them for that. The first thing to say is that you mustn't go round to somebody else's house to watch the match. None of us, not just football supporters, but none of us should be going into each other's homes at the moment unless it is for an essential purpose, such as childcare or looking after a vulnerable person. And I'm afraid, and I know that this statement is possibly a controversial one in Scotland, I readily acknowledge that. I'm afraid that watching football, no matter how essential I know it might feel to some, does not fall into that essential category. In addition, people should not be gathering outside or around the stadium. There will be nothing to see there, so there is no point at all in turning up. And finally, please don't travel in order to try to watch the match. I know there might be a temptation to try and get around local or national restrictions in this way, but it is really important that you don't do that. In general, right now, people in the Central Belt should be avoiding travel to other parts of Scotland, and all of us should be avoiding travelling to areas in England that have high infection levels. So please don't travel to other parts of Scotland or across the border just in an attempt to watch the match in a pub. It's really not worth the risk. Nobody likes the fact that these restrictions have to be in place, but they are vital to protecting all of us and keeping us safe. So please comply with restrictions. By doing that, you will be playing your part in helping us get the virus under control, and you will be helping hasten the day when we can all watch and enjoy the things we love doing, whether that's football or the many other things that we find ourselves not able to do normally right now. Now, I've spoken about some of the restrictions as they relate to football, but I want to close today with my usual reminder to everybody, because this is not just about football supporters, this is about all of us right now. So let me give a general reminder of all of the rules and guidelines. As I said earlier, except for very specific purposes like childcare or caring for somebody who is vulnerable, none of us should be visiting each other's homes right now. That is really tough. I feel that tough, just as all of you feel that tough, not being able to see family and friends at their homes or in our homes. But this is perhaps the single most important thing all of us can do to limit the risk of transmission, to make sure it doesn't jump from one household to another, because we know once it gets into a household, the risk is it infects everybody in that household. When we do meet up outdoors or in indoor public spaces where they are still open, we shouldn't meet in groups of any more than 6, and those 6 people should be from no more than 2 households. Please only car share if it is essential to do so, and if you must car share, remember to take sensible precautions, wear face coverings and keep the windows open to allow ventilation. Work from home if you can. That has been our consistent advice, and that remains the advice. And my plea to employers is to facilitate your workers working from home if it is at all possible. Download the Protect Scotland app if you haven't already done so. That's an important way of extending the reach of Test and Protect. And finally, remember facts. Wear face coverings when you're out and about, particularly in enclosed spaces, and the law mandates that. As of today, that law extends to staff canteens. From Monday, it will be extended to communal areas like corridors and workplaces, but already shops, public transport, it is the law to wear a face covering. But try and wear one wherever you are when you're out and about, because it does help protect from against you passing on the virus, or other people, if they're wearing face coverings, passing it to you. Remember to avoid crowded places. Crowded places, indoors in particular, but even outdoors, can be a risk of transmission. Clean your hands regularly and thoroughly, and clean hard surfaces that you're touching, because we know from hands and also from surfaces, that's a way of the virus spreading from one person to another. Keep 2 metres distance from people in other households, because the further apart you are, the less risk there is of the virus hopping from one person to another. And as I've already covered today, self-isolate and get tested if you have any of the symptoms. Remember, those symptoms to look out for are a new continuous cough, a fever, high temperature, or a loss of or change in your sense of taste or smell. Any of these, please act immediately to isolate and book a test. Don't hang around and wait to see if you feel better in a day or 2. All of these rules take a lot to remember. They take even more effort to abide by every day. But it's really important now that we do. We are in a precarious position. Many countries across the world are facing the same challenges right now. The position we are in requires some really tough restrictions from government, such as not going into other people's houses, pubs and bars, not being able to open as normal. But our best defence, our first line of defence against this virus, and this is as true today as it was back in the spring, is me, you and everybody else complying with all of this basic hygiene advice. As I said yesterday, and it's important to remember, as we head into winter, we're all feeling, I think, more and more fatigued and in despair at this pandemic and everything it is doing to our lives. But remember, we are not powerless. None of us are powerless. By following the facts advice, all of us can strike a blow against this horrible virus. So please remember to do that. Thank you again for listening. Gregor and I will now, as usual, take questions from the journalists. And our first question today comes from Ewan Petrie at STV.
Thanks very much, First Minister. We're seeing significant resistance from leaders in the north of England against proposals to introduce tighter measures there. Do you support their opposition to the UK government's plans and their calls for more financial support? And given the fatigue and the despair you just mentioned there, how concerned are you it's only a matter of time before we maybe see similar opposition here?
Look, we will try our best to work our way and navigate our way through this virus in Scotland, taking people with us as far as possible. I don't expect anybody, individual, local authority, business, anybody, to be thrilled or even remotely happy about the restrictions that we're being asked to live under right now. I hate them as much as everybody does, but I do think we have a high level of understanding and acceptance of why they are necessary. And I will continue to work really hard, and the Scottish Government will continue to work really hard to ensure as far as we can that people understand the reasons for these restrictions, and in the case of local authorities, that we take them with us and involve them as much as possible. I set out in Parliament yesterday the new strategic approach to managing the virus that we will consult on next week and introduce to Parliament for debate and approval the week after that. And that's really important, that we do consult and that we have an understanding of the decision-making processes and where the decisions lie. But we are, and I will never shy away from reminding people of the fact that this is not a normal situation we're in right now. And it's not even a crisis emergency situation of the type that perhaps we are used to dealing with, where government has to take tough decisions. Our enemy here, it's not each other, our enemy is an infectious virus that doesn't wait around while politicians come to agreement and doesn't wait around while we sort of go through lengthy consultation processes. This virus spreads, and it spreads quickly, and it will spread as fast as it possibly can, and it will take advantage of any delay or prevarication on our part. So that's got to be the backdrop and the context in which we all consider all of these decisions. On the issue, I'm not going to comment on discussions in the north of England. I think most people would understand I've got enormous sympathy with local leaders, with the mayors in the north of England. I could see and feel the frustration of Andy Burnham when he spoke yesterday, and he's got a job to do, and he's clearly doing that job to stand up for the people he represents. And I know how frustrating it can be at times to deal with the Whitehall operation. So I've got sympathy there, but I simply repeat the point I've made already. This virus is not standing back, pausing, giving politicians time to come to an agreement. Every day that there is a lack of agreement is a day this virus gets to spread unhindered. I think where there is a point that I would absolutely, I took part in Cobra on Monday, and one of the local leaders for Liverpool was there and made this point. I supported it. If we are asking businesses and individuals to live under these restrictions, we have to be prepared as governments to financially compensate them. And I would make another call today, and I know this is, or I sense this is at the heart of some of the issues with the north of England. The job support scheme that will replace the furlough scheme at the start of November, the level of support there is not sufficient, and I would make an appeal to the Chancellor to take that level of wage subsidy back up to the 80% level that it started at the outset of the pandemic. It doesn't become any less costly for businesses to close today compared to March. In fact, it is more costly because of the damage that has been done. So I would appeal to the UK government to listen to the concerns about financial impact, and for all of us to work together to mitigate that properly. David Henderson from the BBC. Is David there?
Beg your pardon, can you hear me now?
I can, yes.
First Minister, sorry about that. Across the Central Belt, bars and restaurants will remain closed until a week on Monday. Even those in other parts of Scotland face major restrictions. But what comes next is not at all clear. It's a very practical issue for an industry and their suppliers. They're looking to order stock like food and drink. Many cannot plan. What should they do? What's your advice? What can they expect? And will you give them more than a couple of days' notice of what your plans will be when they're eventually announced?
I will give businesses as much notice as possible, but I go back to my earlier answer. We are dealing with an infectious virus. We are trying to limit the transmission. We're trying to monitor and understand the impact of the restrictions that are in place in order to inform decisions we take in future. It's a bit like the argument I made last week in making these arguments. I know how difficult the implications of this are for everybody. But this time last week, we were still in the what's a definition of a cafe debate. Now, if businesses are saying that what they want at an earlier stage is much more certainty, then unfortunately, what we have to do is err on the side of caution. And therefore, in order to try to say to businesses, you all have to close and have no flexibility, or, plan to remain closed, we're trying to base our decision-making process on a manner that allows us to assess and give as much ability for businesses to be open as possible. And that does mean that it is I'm afraid, not always possible to say with absolute certainty a week or 10 days in advance of something what the situation is going to be. Nobody would, well, I'm sure businesses would, but I would love to be in a position here where I could look ahead 2 weeks and say, I can guarantee what the situation is going to be in 2 weeks' time, but I can't do that because of the nature of what it is we're dealing with. And the reason I stand up here every day, as opposed to once a week or once a fortnight, is to, on a daily basis, help people understand where we are in our decision making and what the likelihood is over the days ahead. And I know that's not perfect. It's not ideal for government. It's certainly not ideal for those living with the consequences of these decisions. But it is the reality of what it is we are facing right now. And that just happens to be the situation. Gregor, do you want to talk about the monitoring of...
Yeah. So the reality is, at this point in time, it's still too early to tell just exactly what the full effect of the measures that have been put in place are. And the reason for that is because, again, of the life cycle of this virus. We've spoken about this on a number of occasions. The virus and the infections that we are seeing just now are infections that in reality have probably occurred, the majority of them have occurred before those additional measures were put in place because of the incubation period of this virus, which we know can last certainly up to kind of 10 to 14 days in many cases. So it'll be some time yet before we see the full effect of some of these measures coming through. There are some encouraging signs. I would point to the fact that we know that the number of contacts that people are having with other people has reduced quite significantly within that time. And because of that reduction, what we can infer from that is that there's likely to be less opportunities for this virus to be able to kind of transmit from one person to the next. So whilst there are some of those encouraging signs, it's the coming days ahead which are going to give us some sense of exactly what the impact of these measures are across the country.
Lewis Warner from ITV Border.
Thank you, First Minister. Just on the Old Firm match that's taking place tomorrow, several pubs and bars south of the border in Carlisle have decided either to not show the match, or some have even decided to close their doors altogether. They really fear an influx of Scottish football fans crossing the border to watch the match. With that in mind, and how it's affecting businesses in Carlisle now as well, what would be your message to people seriously still considering going?
Be responsible and don't put people at risk. I know how important football is, but people over the last 7 months have been asked to make the most horrendous sacrifices. People have not been able to get married normally. People have not been able to attend funerals of those nearest and dearest to them. Right now, none of us can go and visit our family in their houses. I'd love nothing more tomorrow, literally nothing more than to go and visit my mum and dad. I can't do that. They can't visit me, and I'm just one of, one person of all of us who are in that position. So I know people, find football important. If I was visiting my dad tomorrow, I know he would probably be talking to me about when he can get back to watch his football team, because he's one of the many, hundreds of thousands of football fans across the country. So I don't underplay that, but in the context of all of the sacrifices, asking people not to watch the match if you're able to watch it in your own home, but just not to go to a pub, not to go to somebody else's house. I'm going to be pretty blunt here. That's not the biggest sacrifice I've asked people to make over the past 7 months. And therefore, I'm just going to say to people, be responsible. Or actually, more correctly, don't be deeply irresponsible by trying to flout these rules, because they are in place for your protection, and they're in place for the protection of the people you love and care about, and they're in place for the protection of our NHS and to save lives. I don't know how to put it any more bluntly than that. And people who still want to flout these rules to watch a football match, I struggle to understand that, but I'll continue to be as blunt as I can be. Callum McQuaid from Central FM.
Thank you, First Minister. We're hearing calls today for more routine coronavirus testing in care homes, and that's after staff members at Fairview in Bannockburn tested positive on a routine checkup. Are you going to make routine testing more available for healthcare staff across the country so that asymptomatic coronavirus infections aren't getting into these settings?
I've answered this question on a couple of occasions this week. Most recently yesterday when I did a virtual session of the Scottish Parliament from here. We are reviewing our testing strategy, as we will do regularly right now, and we are looking at the groups to which we might now extend routine, regular testing, so testing of people regularly even if they don't have symptoms. That currently happens with people who work in care homes, so every week between 30 and 40,000 care home staff are tested, and that allows us to better protect care homes. We've not taken any final decisions on this yet. These proposals will be part of our new strategic framework, which will go to Parliament after the October break. But I said yesterday that two groups related to care homes that we're looking at are people who regularly visit care homes. Well, that's the one related to care homes, but the other social care group would potentially be staff who work delivering care but not in care homes, but care to people in their own homes. So these are groups that are currently under consideration, and we will come to final decisions on these over the course of next week. Yeah.
I think I'm right in saying that we have the most frequent programme of testing within care homes, particularly for staff in the UK just now, and we continually keep things under review. But I guess we also have to balance that with the fact that even testing more regularly than the weekly test that we do just now, people can test positive or test negative in one day and then the following day be at risk of spreading infection because they begin to show the signs of carrying the virus at that point in time. So whilst testing is incredibly useful, what's much more important alongside that regular testing programme is that people continue to make sure that they're taking all the steps available to limit any sense of transmission. So make sure that they are wearing PPE properly and using it in all the kind of appropriate interactions with others in that care home, that they're not putting themselves and others at risk when they're interacting outside those immediate care interactions, that they're making sure that when they're in the social environment of these areas as well, that they're still taking all the precautions, that they're washing their hands regularly. It's these things which make the biggest impact. And whilst testing is incredibly useful and future technologies may allow us to go even further than we do just now, at this moment in time, I'm confident that the testing programme that we've got in the care homes for staff just now is adequate.
Thanks. Greg Fluker from Kingdom FM.
Thanks, First Minister. Tomorrow is the start of the lower leagues in Scottish football. Today, Dunfermline's chairman has issued a statement warning of the catastrophic impact on clubs if some form of central government support isn't forthcoming. He says there's many anomalies across the economy and they just want parity with other sectors. He's also concerned that many fans may be lost to the game for good, and the work that clubs do in their communities, like supporting people with mental health, is being eroded at an important time. Firstly, why are clubs not receiving the same financial support as other businesses? And can you give us an update on the discussions between the Scottish and UK governments over some form of support for clubs?
These discussions are ongoing. They haven't reached any firm conclusions yet. We will continue to push the UK government to make support available for football clubs. I think the point about lower league community-based clubs, the football's important, but often the work they do in a wider community sense is important too. So I endorse that point. The Scottish Government, and I make this point regularly, and I always say, because I think it's important to say, that I'm not trying to be political, I'm just trying to be factual with people. Our resources are finite. You know, the £40 million that we're making available to hospitality, we found that within our own resources. We're using some of that to top up the furlough scheme so that workers get more of their wages paid than would be the case under the UK government scheme. We cannot find money within a finite budget for absolutely every business, individual and organisation that understandably wants funding, which is why we have to pursue these discussions with the UK government on football. That is what we will continue to do. Neil Pooran from PA.
Thanks, First Minister. In terms of the modelling document that was released yesterday, there's a scenario, calls it the worst scenario, where cases are still rising towards the end of October. How would that sort of situation fit into the strategic framework that you're working on just now? And also, have there been any more discussions or thoughts around Christmas time and the rule of six and household visiting around that time?
We think about all of these things, but no, we're not in a position to take decisions. And I know how tough this is for people thinking about Christmas, as everybody starts to do it this time of year, but we can't take decisions here in mid-October for late December, unfortunately. I've just answered a question that says I can't yet say for certain what the situation will be a week, 10 days from now, can I just ask people to remember what we are dealing with here? An infectious virus that unfortunately doesn't always behave in the way that we want it to behave, and that makes life really difficult for those of us trying to take decisions, and even more difficult for people who are living with the consequences of these decisions. But there's nothing to be gained from me standing up here telling you that it is anything other than that. And as I say, that's why I do stand here every day, so that we can continue to, on an ongoing basis, update on the decisions that we are taking. In terms of the modelling, what the strategic framework is intended to do is be a strategic framework, an obvious point here, that then any of the real situations that we might face can be accommodated within. So it is looking at, if you've got low spread of the virus across the country or in a particular part of the country, what are the interventions that would be appropriate? If you've got medium spread, what would the interventions be appropriate? And if you've got very high spread, what interventions would be appropriate then? So that allows us to take account of all of the real life scenarios that unfold with this virus. And when we publish that overall strategic framework, it might not be identical to the one published in England earlier this week, but that gives you a sense of what kind of strategic document it's going to be. At that stage, based on the latest epidemiology, the latest case numbers we have, the latest modelling we have, we will say what level each part of the country we think should be in, and that work is ongoing right now, taking account of all of the modelling and all of the real-time information that we have at our disposal. You probably can answer that question a lot better than me.
Neil, I mean, first of all, thanks for your question. It's a really good opportunity just to pay tribute to the people who are involved in this type of work, the analysts and the statisticians who work alongside us and who continually feed us with data and modelling figures which help us to plan for the future. We use that data not as a predictive tool, so it's not a prediction of what's going to happen next, but we use that to chart alongside the actual real world data that we're seeing, just to get a sense of how we are progressing against the kind of fight against this virus just now. It's useful for us, not just in terms of planning for different scenarios that may evolve in the future, but also for making sure that any interventions that we put in place are having their intended effect as well. So, as I say, the modelling data that you're referring to that's published on a regular basis, is published every Thursday on the Scottish Government website, is only one part of a range of information and modelling that comes from these teams and that helps to inform our decision making.
Thank you. Conor Matchett from the Scotsman.
Thank you, First Minister. If I may, I'd like your reaction to Boris Johnson saying that there's very little prospect of a trade deal in the Brexit talks in January. And I've asked you this before, but I was given the pertinence. Are you confident that Scotland and the Scottish Government can cope with the challenges of dealing with what is likely now to be a no deal and also an accelerating second wave of COVID-19?
Thanks, Conor. I'll be brief about this because the question is legitimate, because obviously there are linkages between having to deal with COVID and having to deal with another massive disruptive event. But I don't want to veer too much into Brexit, because that obviously would take me into, to some extent, political territory. But I feel deeply frustrated and depressed at the prospect of no deal at the end of the transition period in December. That said, we've got to be realistic. Any deal that is struck right now will be such a bare minimum deal that there is going to be disruption at the end of this year. I think that is now inescapable. And, I find it very, very frustrating that at a time when all of us should be giving, and I am seeking to do as much as I possibly can, 100% of our time and focus and energy to COVID, that the Scottish Government, and this will be true of other governments across the UK, are having to think about how we cope with the prospects of Brexit, where the implications of that are potentially huge. Am I confident we can cope? We will do everything we can to deal with the implications of that, but make no mistake, resources are finite, and every civil servant or every hour of my time that has to be spent right now thinking about the implications of a no-deal Brexit or a bare minimum deal Brexit is a civil servant or an hour of my time that is not focused as it should be on trying to steer the country through the COVID pandemic. So I feel deeply depressed about the Brexit situation, and I think that is particularly because it is avoidable. Earlier in the year, you know, I'm not going into other things, but at the start of this pandemic, to no doubt the dismay of some people in my sort of base of supporters, I said, look, you know, planning that I might have been doing for constitutional matters that I support was put on pause and on hold, because this had to take all of my time and attention. The UK government could have done that with Brexit and said, we're going to ask for an extension to the transition so that we don't have to worry about these things until we're out of COVID. It didn't do that, and that, you know, is a matter of real frustration and depression. And that's not just because I'm an opponent of Brexit, everybody knows that, but it is because we don't need another big thing to be dealing with when all of us should be focusing on the COVID priority that lies ahead of us. Tom Peterkin from the P&J.
Good afternoon, First Minister. There's been reports of late delivery of letters calling people for their flu vaccinations in the North East. NHS Grampian is working with the Royal Mail to try and resolve this situation that's been described as a shambles, with elderly people not getting their letters in time for their appointment. I just wondered if this was something you were prepared to look into.
The Scottish Government is quite literally on a daily basis in discussions with health boards about the progress of the flu vaccination campaign. I again covered some of this in my update to Parliament yesterday, so we will be discussing with NHS Grampian any implications of late delivery of letters and asking NHS Grampian about the plans they are putting in place to mitigate against that. As I said yesterday, by the end of this week, I think around a quarter of people eligible for vaccine, the flu vaccine, will already have received it, and health boards have plans in place to vaccinate everybody in the eligible categories. It's been done differently this year because of COVID, so there, you know, will be some issues in terms of the arrangements not being what people are used to, and perhaps some issues arising from that, which is why we're working closely with health boards to address any that arise.
I think all I would say is I'm very encouraged by the evidence of the early uptake figures for the flu vaccine just now, and the enthusiasm that people are showing for getting the flu immunisation this year. I can't emphasise enough the importance of this. We have a little bit of time yet to make sure that we are immunising those who are at risk. What we generally tend to see in this country is we tend to see a rise in flu cases, which we most commonly associate with later in the year, with December probably starting to show the signs of really picking up. Number of cases at that point in time, and the flu programme in its entirety is designed to make sure that we're immunising the majority of those people who are at risk well in advance of this.
Christine Lavelle from The Sun.
Thank you, First Minister. The Labour MP Ian Murray has said this morning that tomorrow's Old Firm game should be postponed if there's any risk to public health. I just wondered what your response would be to that, and given your warnings today about household mixing and people travelling out with their health board area, how concerned are you that this game does pose a risk to public health?
Firstly, it's obviously not within my gift alone to postpone football matches. The football schedule is for other people. I can make my views on these things known, as I have done over the past months. I say this with a wry smile, not as a criticism of anybody. I suspect it's one of these things where had I said it should be postponed, people would be criticising me for that, and given that I haven't, people are criticising me for that. That's just part and parcel of my job, but I say it with a wry smile. It's, I guess, the luxury of opposition. But on the fundamental issue, this will be a risk to public health if football supporters don't behave responsibly. I believe the vast majority of football supporters will behave responsibly, and actually not just because, or perhaps not at all because I'm telling them to, but because football supporters are human beings like the rest of us. I'm standing next to one. I, like watching the odd game of football as well, and odd game is not meant to be a reflection on my team, which is Ayr United. I should stop talking right now, or my father will be having a fit. But the vast majority of football supporters care about their own health. They care about the health of their loved ones. They care about their communities. They care about the NHS. They don't want people to unnecessarily die. So I suppose at the heart of calls saying postpone it, these are predicated on people not behaving responsibly. And I think the majority will, and the minority who might be thinking about how to get around these rules, I would repeat my plea to them, please don't do that, because you're putting yourself and others at risk, and it is not worth it. And it makes this situation so much more difficult than it otherwise already is. As probably more of a regular football supporter than I am, do you want to say anything else?
Yeah, so thanks for the opportunity for saying something, because I think it's really important. I know how tough it's been in supporters over the course of this season so far, not being able to get back into stadiums. And you people out there, you've got my sympathy, because I know what it feels like. The bottom line is, just now, it's not yet safe to do so. And there's a particular issue that we must not fall into the trap of this weekend, because whilst I understand why people want to gather together for a game like we'll see this weekend, in doing that, you're not only putting yourself at risk, but you're putting your friends at risk, you're putting your family at risk, and potentially putting your workmates at risk when you go back to work afterwards as well. Because we know that the kind of places that people gather to watch football are risk of high transmission, whether that be nipping round to someone's house to try and watch the game there, whether that be travelling to go to a pub somewhere. These are high risk environments for the transmission of the virus. My advice to you, my ask of you, is please don't put yourself at risk, don't put your loved ones at risk by doing that. We know already the evidence that there are particular parts of the country just now, elsewhere in the UK, where it's high evidence of high prevalence of disease just now. And like everyone else, I've read some of the reports about supporters planning to travel elsewhere in the UK to try and watch the game within a pub or something like that. Again, my ask of you, please don't put yourself at risk. It's not just yourself you're putting at risk here, but you're putting at risk, as I say, the likelihood of bringing that virus back with you, introducing it to your household. And we know from the evidence that once it's introduced into your household, it's likely to spread to others there as well. And I think the vast majority of football supporters understand that, and I think they will follow the guidance as it's issued just now. And so that, for that reason, I don't see any reason to postpone this game this weekend.
I think I'll just make one final point. Well, it may not be my final point on football, because I don't know what the rest of the questions will be, but sometimes I think it's better to think of this not in the abstract about, you know, crowds of football fans or football matches. All of us, and this applies not just to football, it applies to everything we're doing right now. We can all think, I can do it, we can all do it, think of vulnerable people in our own lives, in our families or wider networks. And every time one of us puts ourselves in a position where we are unnecessarily and avoidably exposed to this virus, we could, completely inadvertently and unwillingly, I know, but we could be setting off a chain reaction that leads to that vulnerable person in our own lives getting the virus and becoming very ill, or worst case scenario, dying. So I think we all have to think about it on that personal level. Think about the person in your own life, and I would caveat this by saying anybody can get ill and die from this virus, but I think, you know, we know that vulnerable people are more at risk. So think about who that is in your own life, and then think about the chain you could be setting off by going to sit in a pub to watch the football, or nip into somebody else's house to watch the match. And I know we're focusing this in football because that was the question, but that actually applies to everything right now. And I think it is important to think about it in those terms, because that actually is the reality of what we're facing. Matt McLaughlin from The Times.
Afternoon, First Minister. Can I ask about your ambitions for testing? We were told that the ambition is 65,000 tests per day by the winter. And we've also been told the ambition is to do all testing under the banner of the NHS by December. So can you confirm that the ambition is 65,000 tests by some point in December under the NHS? And given that that's going to be more than a tenfold increase in the amount of NHS testing just now, can you just explain a bit about the logistics of how that's going to happen? Is it going to be NHS staff that are doing it? Is it going to be academics that are currently doing it under the banner of the UK government, shifted to NHS managers, that kind of thing?
Mark, I mean this very respectfully. I don't know whether it's just how you've articulated that question or whether there are genuine misconceptions at the heart of it, but just so much of what you said there is not accurate that it's kind of hard for me to give you an answer predicated on that question. And happily, we will be publishing over the course of the next week to 10 days a revised testing strategy, which will set out our latest actual capacity in terms of testing, test processing, and our projections through to the end of this year. And that takes account of NHS Scotland testing capacity, the UK Lighthouse Lab capacity, and some other potential innovations in terms of point of care testing. So you will see that all set out. In terms of some of the misconceptions, we are transferring right now care home testing from the Lighthouse Lab network to the NHS, and we are about 25% or between 25 and 30% of the way through that, and that process will be complete by December. We are building up NHS capacity beyond that, because we will then use that to do some other new groups, potentially of asymptomatic testing. We are not transferring all testing that is done to the NHS, so we will still continue to maximise our Scotland's share of the UK-wide Lighthouse laboratory network and any expansions of that capacity, because there are also planned expansions of that capacity and other innovations that are coming on stream. So that's what we are working on, but as I say, that will all be set out in our updated testing strategy within the next week to 10 days. We haven't decided on the final publication date of that yet, so you'll be able to see that there in black and white. So I've tried to answer that question as best I can, but as I say, I don't know whether it was just how you articulated it, but there are just some misconceptions in the question that probably means that I can't go any further than that at the moment. Dan Sanderson from the Daily Telegraph.
Thank you very much, First Minister. Just on the hospitality restrictions, the government's previously described these as a 16-day reset. But from what you've said, I appreciate all you've said about not being able to see into the future. But it sounds like there's at least a strong possibility that these businesses in parts of the Central Belt won't be able to reopen after the 16-day period comes to an end. And I just wanted to check whether that was fair. You can also check under the new system that's coming in. Will it still be by health board area that any restrictions are imposed, or this sort of traffic light systems applied, or could it be by council area? I mean, I was just looking at the figures there, and the likes of Inverclyde, Midlothian, East Lothian have got lower cases than places like Aberdeen, Dumfries and Galloway. Obviously, they're shutting the former, not on the latter. So I just wonder if that's something you're considering. Thanks.
We will apply interventions at the level we think is necessary. If that's whole health board areas, that's what we will do. If it is part of health board areas, that's what we will do. If it's council areas or part thereof, that's what we will do. So that I think is the principle here. We apply interventions at the base, on the basis we think is necessary. Now, I'll be corrected if I'm getting this wrong. I don't think I am. But back a few weeks ago, when we first applied additional restrictions on Greater Glasgow and Clyde health board area, we did that on certain council areas within Greater Glasgow and Clyde. So Inverclyde was never included in these restrictions, even though it was part of Greater Glasgow and Clyde health board. So we take decisions that we think are proportionate. Gregor may want to say more about that in a sec. On the question about hospitalities in the 16 days, the regulations that gave effect to the temporary restrictions will expire on the 26th of October. What I tried to say yesterday is that COVID will not be gone by the 26th of October. We know that we are still dealing with a very serious COVID situation. So what we will do between now and then, guided by this new tiered level of intervention, is say what restrictions and interventions will apply in different parts of the country. And that will depend on the most up-to-date epidemiological assessment that we can get, which tells us how the virus is spreading and what levels of intervention might be required in different parts of the country. And we'll be consulting with other parties, other parts of society over the course of next week on that framework, and we will be open about the evidence that guides our decisions about which level applies to which parts of the country.
I think it's really important that we continue to be led by what the evidence is telling us when we're dealing with any particular outbreak. And over the course of our response, particularly to these outbreaks since July, you'll recall that we have taken slightly different approaches for slightly different scenarios. So whether it's been examining things on a postcode level, as we did in Dumfries and Galloway, on a local authority level, as in, for instance, when we approached the situation in Aberdeen City, or whether it's been latterly the kind of increased restrictions we've put in place across the Central Belt at a health board level, we've taken the option as to what the data and the evidence leads us to believe is the best level that we intervene in order that we kind of safeguard and contain the virus there. We'll continue to do that, and we're fortunate in that the data that we have allows us to drill down to kind of quite deep levels of understanding in terms of the spread of this virus. At this moment in time, what we see from that is that there is more evidence of more generalised transmission across these communities that necessitated that higher level of restriction going in place across the health board areas.
Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. Can I just check quickly with the new rules on face coverings? Obviously, I think you said that from Monday, face coverings will be required in communal areas in workplaces such as corridors. Can I just check what the advice is for open plan offices? Is that considered a communal area? And can I also ask, you obviously suggested yesterday that the Scottish Government is considering cross-border travel restrictions along similar lines to those being planned in Wales. Have you had any response to the letter you sent Boris Johnson the other day, inquiring about a Four Nations approach to travel restrictions? And more widely, how would you see such restrictions being enforced?
On the first part of your question, if you don't mind, I'm going to just double check the answer to that before I give you it so that I'm absolutely getting it right, because when we talk about regulations, I just want to make sure that I don't inadvertently give an answer that says, yes, something is included or it's not included. So I'll come back to you, or somebody in my team will come back to you about that as soon as possible this afternoon. On the travel point, I have actually just read a response from the Prime Minister to my letter of the other night suggesting or agreeing that there should be some Four Nations discussions to look at how we do these things. I welcome that. Obviously, we will, in parallel, continue to consider what steps we might want to take. Enforcement is one of the issues we have to consider in all of this. I said pretty candidly in Parliament yesterday that, whether you have guidance advising people not to travel or the law says you shouldn't travel, it stands to reason you can't have a police officer checking every car or every journey that people are making. So whatever the system is based on, guidance or regulation, it involves a lot of willingness on the part of people to comply with that. So one of the things that we will be weighing up and deciding what to do is whether a regulatory approach coupled with enforcement gives us a more meaningful way to, where necessary, because we don't do any of this lightly, restrict travel from high to low prevalence areas. And we'll obviously, as and when we reach decisions that would lead to a change in the current position, we will set that out fully. But I certainly welcome. We've all got to take these decisions within the Four Nations, but given the nature of travel, particularly around the border, Scotland-England and England-Wales, the more we can align our approaches here, whether that is an aligned approach around guidance for where people should and shouldn't be travelling to, or an aligned approach around enforcement, I think it would be helpful if we could reach that, and we'll see where those discussions get to. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. Just to pick up on the same point, in response to your letter last night, Down the Street had said that their guidance has already been clear that people from very high prevalence areas shouldn't travel in or out of that area. So, do you get the impression that there is a willingness across other parts of the UK to go down the enforcement route? And if you do go ahead yourself on this, will you be looking at potentially banning people from areas such as Greater Glasgow and Clyde, for example, from visiting the Highlands or other low prevalence areas?
Well, any travel restrictions, should you decide that they have to be mandatory, this is not just about cross-border, which is why I keep saying this is not some, constitutional point or political point. It's about high to low prevalence. And if that's within Scotland or within England or within Wales, then you have to consider that there. But equally, you have to consider it if it's between any of these countries. Right now, my advice to people in Greater Glasgow and Clyde is not to go to the Highlands unless it is, you really need to. We didn't go as far as saying to people over the October holidays, if you've got a break planned, cancel it, because we're trying to, strike as much balance here as we can. But my advice now to people in Greater Glasgow and Clyde is if you don't need to travel outside of Greater Glasgow and Clyde, don't do it. That is advice and guidance, but it is there and it is very strong for the reasons everybody understands. And last question today is Richard Percival from the Daily Express.
Thank you, First Minister. I just wanted to add on the travel restrictions and whether you are aware of comments made by the Police Federation of England and Wales, which warned Mark Drakeford that their measures would basically be unenforceable because they basically would be hard to tell where people have travelled from. Are you aware of these concerns, and have you had discussions with Police Scotland and the Scottish Police Federation on this matter when considering these measures yourself?
No, I'm not aware of comments from the Police Federation in England. We have ongoing discussions with Police Scotland. Every piece of enforcement, regulation and enforcement that we have introduced, and this will continue to be the case, we do through discussion with Police Scotland so that we understand as we do it what the issues and any concerns they might have around enforcement, and that would be part of any process. Let's not forget why we're doing this, and anything you do to try to stop a virus spreading, if you put it in law with enforcement attached, of course there are always going to be practical challenges. We've gone through 7 months of, for goodness sake, of telling people not to, or not all of the 7 months, but part of them, telling people not to leave their own homes. This is not easy for anybody, but we're doing it to try to stop a deadly, potentially deadly and quite harmful virus spreading. So we always have to make judgments. Just because something might be difficult, in some examples, the difficulties of enforcement might lead you to say there's no point doing that. In other examples, you might say, yeah, that's not the easiest thing to enforce, but even taking account of that, it would still deliver some benefits over and above a purely voluntary approach. So these are the kind of difficult considerations and decisions we are having to weigh up and reach every single day against a backdrop of none of this being ideal and none of this being easy. So that's how we will approach this issue as well. And we'll learn from other parts of the UK, and we will try to discuss and have as much collaboration with others as possible. Gregor, do you want to add anything before we finish, since we're at the end of the questions?
Can I just pick up on the points just about travel here, because I think what I would make a plea for is that people don't lose sight of the public health basis around this part of the discussion, because it's just common sense, isn't it? Is that people who currently stay and are moving around within a high prevalence area, if they move out of that area and into a low prevalence area, they're much more likely to take the virus with them and start to seed new cases in those new areas. And we've got evidence of that from over the time since we kind of started to reopen up society in July. Likewise, for people moving into those higher prevalence areas, socialising in those areas, going to visit people, it just makes, again, common sense. You're more likely to contract infection in those areas as well, and that's why those restrictions are in place just now. So my plea to everyone is to be aware of that and to make sure that you are constantly checking, questioning yourself as to whether any travel that you're currently undertaking is truly essential or not, because again, I go back to the point that I made earlier on in the briefing, is why put yourself at risk, why put those around about you at risk if you can avoid it just now?
Thanks, Gregor, and thank you, Rachel, as well, for our BSL interpretation today. Thanks to all the journalists for their questions, and thanks to you for joining us. Let me just end with a very brief summary of all of the rules and guidance that we're asking everybody to abide by. First of all, please don't go into other people's houses right now, because we know that helps the virus spread. So unless you need to for childcare or looking after a vulnerable person, or you're part of an extended household arrangement, stay out of the houses of other people. Please don't try to get round the rules on hospitality by travelling to other parts of the country or across the border. And that applies to football supporters just as it does to the wider population. If you live in these 5 central belt health board areas right now, the advice is don't travel outside your own health board area unless you really need to. And for people elsewhere in Scotland, don't travel into these areas unless you really need to. And for all of us across Scotland, don't travel unless essential to higher risk parts of other countries in the UK. Please work from home if you can, and employers, please facilitate that. Download Protect Scotland app and remember facts. Face coverings give you and others protection. Avoid crowded places, clean hands and surfaces. Keep 2 metres distance from people in other households when you are in contact with them, and remember to self-isolate and get tested if you have symptoms. It's never easy any day of the week to stand up here and give advice that leads to massive restrictions on and changes to life as we know and enjoy it in normal times. But I'm also always conscious on a Friday that it feels a lot harsher than it does the rest of the week, because weekends are the time when many of us enjoy seeing family and friends and doing the things that we like to do to relax a little bit. So it's always much harder on a Friday to remind people of the things we're asking them to do, and more importantly, the things we're asking everybody not to do. It's not easy right now, but we are, I'm afraid, again, at a situation we've never quite got completely out of this, but we had a little bit more flexibility for a period. But right now, it is time to fire up the Zoom chats for contact with other friends or family members outside our own household, getting the winter coats on to maybe see people outside at a safe distance. None of us enjoy this. None of us find this pleasant or welcome. But let's not forget what it is about. It is about stopping this virus spreading, stopping people getting ill, enabling our health service to continue to care for everybody who needs it, whether they've got COVID or other conditions. And ultimately, it is about saving lives. That's the objective we started with, and it is still the objective we have today. So from my heart, thank you for everything you're doing to help us with this unavoidable collective endeavour, and please stick with it, because it is for your protection and for the protection of everybody you love. Thanks very much for joining us today. We'll be back here at 12:15 on Monday for the next update. Thanks very much.